So there's a lot of different research studies, and I'm sure we'll get some questions about it in the panel, but I thought I'd just go over a couple of the different things that are going on. But if anyone has any specific questions about any specific research, I tried to buff up on everything before I got here. But we're just going to go through some of the basics. So let's get going. So just basically, what is a clinical trial? So before everything starts as an idea. And before it goes from an idea to a medication or a treatment, it's got to go through different phases of trials to make sure that the medication is in phase 1 safe in a small group of people. Phase 2 of a trial is the drug effective? Is it worthwhile looking at in a larger group of people? And then phase 3 is typically a longer study where they look to see if the medication is safe or the intervention is safe. Is it effective? What are the long-term side effects? And all of this has to go on before something is approved by the FDA as a treatment or an intervention for a condition. So what are we looking for in Parkinson's disease? There are a couple things that we want. We want to look for new treatments of motor symptoms. So is there anything different that we can do to help tremor, stiffness of movement, slowness of movement? We want to treat the non-motor symptoms, so all those other things that we were talking about before. Hallucinations, things like lightheadedness, constipation, people who have problems with drooling. So there are a lot of different symptoms that we want to make sure that we're looking to see if there are any new treatments that we can find. And then most importantly, is there any disease-modifying therapy that can either slow down the progression of Parkinson's disease or potentially stop it? And then is there anything that we can find that would be a biomarker for Parkinson's disease in people who don't have it? Meaning, can we predict why people get Parkinson's disease? Because ultimately, that'd be great. Because if we can find out why people are getting it, then maybe we can prevent it from happening in the first place. So, like we talked about before, I know you already saw this slide, but the different motor symptoms of Parkinson's disease are the tremor, slowness of movement, instability, and then also muscle stiffness. So we're going to first talk about just a couple different things that they're looking at right now that could potentially be new medications for the treatment of motor symptoms in Parkinson's disease. So there are 2 new methods that they're looking at to deliver levodopa to people, both in the kind of more emergent situation, kind of like that Avokin we talked about before, being an immediate off, and what do you do in that situation? And then also different ways to deliver the medication to people who are having big ups and downs. Those people who might be a good candidate for either an extended release medication, that pump that we talked about, or even deep brain stimulation. So one of the first ones is this new thing that they're looking at called Narinder. So one of the problems with Parkinson's disease, as we talked about before, is that some people have problems absorbing the medication into their GI system because either things move slowly or it can interact with protein. Some people have to take oral medications multiple times throughout the days and have varying levels in their blood, which can either cause off time or dyskinesia. Narinder is a subcutaneous infusion of levodopa. It's a little patch you wear on your skin and then a little box goes on it. I've got a little picture of it on the next slide. And the whole goal would be to give you a continuous, potentially 24-hour infusion of levodopa throughout the day. You wouldn't have to take oral therapy. And the other thing is, it wouldn't be infused into your GI system, and so you wouldn't have to worry about it not being absorbed if you have slow GI movements, and it might not interact with protein as significantly as levodopa in the gut. Might still, yes, yeah. It might still interact a little bit because protein can block the absorption of levodopa from the blood into the brain, but this might significantly change that. So it's currently in, went too fast. So phase 2 trials have shown it to be effective in small groups, and so it's currently in phase 3 trials looking to see if it's safe and effective in the long term. So this is what it would look like. It would be a little patch that would go on your skin, probably on your abdomen, and then it would be a little box attached to it. It would almost be like an insulin pump for Parkinson's disease. So a rescue medication that they're looking at, and they've actually filed a new drug application for this with the FDA, is called CDT-301. It's not a very good name for it yet, but I'm sure they'll come up with something more fancy. But it's an inhaled form of levodopa, and this is for people who have kind of all of a sudden off symptoms. And when you're all of a sudden off, you need that levodopa really quickly. This is an inhaled form of levodopa because you can actually absorb the levodopa through your lungs. It almost be like an inhaler, and it can actually, in the earlier studies, it's shown that this medication can improve people's immediate off symptoms. So it'd be like a quick boost of levodopa that you would take in an inhaled way. So this has actually been filed for a new drug application with the FDA, so we're just waiting for that to come out. There's a long-term study going on looking at when we should do deep brain stimulation in Parkinson's disease. A lot of the times we think about it more typically being used in people who've had Parkinson's disease for 3 to 4 years, who are having problems with their medications, who are having problems with symptoms that aren't controlled by their medications. But there's a question whether or not maybe using deep brain stimulation early on, could that give people benefit later on? So what this study is looking at is it's taking people who don't have the big dyskinesias, who don't have the symptoms that are unresponsive to levodopa, are doing DBS earlier on in the course to see if maybe it gives them better control of their motor symptoms over time, and would it potentially slow down the course or progression of Parkinson's disease by giving deep brain stimulation earlier. So this is a long-term, ongoing trial. We don't have any definitive results from that yet, but that's something else that they're looking at. They're also starting and continuing to look at the use of focused ultrasound in Parkinson's disease. Who's heard of focused ultrasound? Yeah, so this is something that we intermittently use in people with essential tremor, which is a condition that just causes tremor and doesn't really cause a lot of the other things that people experience with Parkinson's disease. What it does is it uses a focused beam of ultrasound, so sonic waves, that are targeted at a specific spot in the brain that creates a small little lesion, almost like a little scar in the brain. The whole goal of this is to use this to see if we can decrease the symptoms of Parkinson's disease in people who may not be a good candidate for deep brain stimulation. The difference with this is a permanent little scar on the brain, and we can't really adjust the size of that scar over time like we can adjust a deep brain stimulator system. It's a very good option for people who may not be a great surgical candidate. And so that's something they're looking at as well to see if it's safe, tolerable, and effective in people with Parkinson's disease. There are also a lot of non-motor symptoms that we've talked about many times before today that can occur in Parkinson's disease. So 2 of the medications that they're looking at, one of them is for constipation. A lot of the pro-motility agents that we use in Parkinson's disease can have side effects and interact with the dopamine receptor. One of those medications is Reglan or metoclopramide. Has anyone heard of that one before? So we try to stay away from that medication in people with Parkinson's disease because it can interact and potentially block the dopamine receptor, worsening the symptoms of Parkinson's disease. So one of the medications they're looking at is camisinol, I think I'm saying that, and that's a medication that is actually a pro-motility agent, meaning it stimulates the GI system to start moving, but it doesn't interact with the dopamine receptor like a lot of the other pro-motility agents that we have now. So that's currently under a phase 2 trial, and it has actually also shown that people have a better response to their medications because it moves them through the GI system into the places where the medications are absorbed a little quicker and a little better. Another thing that they're looking at is something called tropicamide. It almost looks like one of those Listerine minty things that you put in your mouth, the little sheets. Well, one of the symptoms of Parkinson's disease is drooling. It's not because you produce more spit, it's because you just swallow it less quickly and less frequently, and then it pools in the mouth and kind of drips out. So the things that we do for it right now, sometimes we use eye drops or have you chew gum or use hard candy, because the gum and hard candy makes you swallow it quicker. some of the eye drops can actually dry out your mouth, but those are sometimes absorbed all around the body and can cause side effects. And some of you, I know, receive Botox for your drooling because that actually decreases the production of saliva and can be very effective for some people. But this would potentially be a medication that they would use where you just take a little strip, put it on your tongue. It wouldn't be absorbed all around the body and cause side effects. And it would be a local treatment for increased salivary production and could help with drooling. So, kind of what everyone's interested in are these potentially disease-modifying therapies. When we think about disease-modifying therapies, we want to look at the different things that can potentially contribute to Parkinson's disease. Antioxidants can potentially, byproducts of oxidation, meaning when you metabolize food, it can create different byproducts, free radicals and other things. Those can be toxic to cells. Inflammation can be toxic to cells. We're going to look at different neuroprotective factors. And then there's this thing, alpha-synuclein. I know I'm doing a lot of hand raising. Who's heard of alpha-synuclein? Yeah. So one of the medications that they're looking for, one of the compounds they're looking at, is something called inosine. Inosine is a precursor to uric acid. And there have been observational studies, meaning they kind of look at the general population, and they found that higher uric acid levels could potentially put you at a lower risk of having the progression of Parkinsonism. So they've done studies looking at people, they've done small studies that have shown that it's relatively safe for people to receive this inosine, and they haven't really looked to see if it has modified the progression of Parkinson's in people with Parkinson's disease yet. The whole theory is that if we boost uric acid levels, maybe we can slow down the progression of Parkinson's disease. So that is now undergoing a phase 2 trial, meaning a small group of people looking at inosine to see if it's, actually they've done the phase 2 trial, they're looking at phase 3 studies to see if it can actually maybe modify the course of Parkinson's disease. Inosine is not something that we recommend you take yet, because we don't know the long-term side effects. Inosine can potentially cause gout, because it boosts uric acid levels, can cause hypertension, and potentially interact with other medications. So this is not something we recommend. It is available commercially, so you can buy it over the counter or from naturopathic supplement stores, but this isn't something that we recommend taking yet because we don't know the long-term effects of this medication. So then we talk about alpha-synuclein. So it's not always a bad guy unless it's folded up in the wrong way. So like we talked about before, alpha-synuclein is the abnormal protein that accumulates in dopamine-producing cells, is toxic to those cells. When it accumulates a lot, it aggregates together and clumps up and forms a Lewy body. Those Lewy bodies are toxic to those cells. They cause death of those dopamine-producing cells. And when you've lost a certain amount of your ability to produce dopamine, you develop the symptoms of Parkinson's disease. So the thought is that if we could decrease either the production of that protein in the abnormal form, or we could help with the clearance of that protein from those cells in the central nervous system, then maybe we could either slow down the progression of Parkinson's disease or potentially prevent it from happening if we can figure out exactly what's causing the Parkinson's disease and prevent it in the first place. So they're looking at a couple different things to see if it can have any effect on alpha-synuclein in the central nervous system. One of those things is phenylbutyrate. What it does is it turns on a gene that actually helps to clear out alpha-synuclein from the central nervous system. What they've seen is that in patients with newly diagnosed Parkinson's disease who are administered this chemical, they actually have elevated blood levels of alpha-synuclein, which is not a chemical that typically floats around in the periphery. So that means that they're thinking this chemical potentially clears that protein from the central nervous system into the blood and then is excreted. They have not looked at whether or not this chemical can potentially improve the symptoms of Parkinson's disease, but that's what they're moving towards with the new studies, is to see, is it safe and effective? So there's another thing called apatow. This is actually a immunization against alpha-synuclein. So kind of like, can you immunize yourself against the virus? It'd be immunizing yourself against the protein. They've looked at a really small study looking at a couple patients receiving this injection over the course of a year, and it's actually been shown to be safe. And so now they're moving from just a safety study to looking and seeing whether or not this injection over a long-term period could potentially modify the progression of Parkinson's disease in those patients receiving the injection. There are other theories that can we use different medications that modify the immune system to potentially help with the decreased deposition or increased clearance of alpha-synuclein from the central nervous system. One of those that they're looking at is Narinder. It's a cancer drug that they typically use to treat a specific type of leukemia. So it works to kill the cancer, but in this context, it could potentially activate the immune system to help eliminate this abnormal protein from the central nervous system. So the phase 1 trial showed that it was actually safe, and it also showed that patients who were treated had a decreased level of this alpha-synuclein protein in their central nervous system. So what they're looking at now is a phase 2 trial to look to see if in a bigger group of people, is it safe, is it tolerable, and is it potentially effective at changing the symptoms of Parkinson's disease. So a lot of these are first safety studies before we can really say, does it change the symptoms of Parkinson's disease or not? And then the question that we get a lot is stem cells as well. And what is going on with stem cells? So there are a lot of different types of stem cells. You have embryonic stem cells, you have adult stem cells, and then you've got these other type of stem cells called induced pluripotent stem cells, which is where a lot of the research is going on, which are adult stem cells that you can actually make into a stem cell that can change into anything. Embryonic stem cells are typically easier to work with because they don't have a pathway yet, and you can induce them to go into a lot of different directions. The adult stem cells are typically developed and they have a direct pathway as to what they're going to turn into, but they found ways to change adult stem cells so that they can go in a bunch of different directions. The one for Parkinson's disease would be going into the direction of a dopamine-producing cell. So they've looked at a lot of things, but there are a lot of things that they haven't really figured out how to do with stem cells yet. So the goal is they have to figure out how to make that stem cell turn into a dopamine-producing cell. They have to figure out how to make that stem cell grow and make the appropriate connections to different areas of the brain, because if you just have a dopamine-producing cell in an area and it doesn't make connections, then that dopamine won't go from one spot to another spot. And then they also have to control the growth of the cell, because if you don't control it, it could turn into a lot of cells, and that could be a tumor. So there has to be a lot of different things that they do. So what are they looking at in current studies? They're looking at whether these cells are safe to use in humans. They're looking at whether or not those cells can make those connections and also survive in the Parkinson's disease brain. Meaning, are those cells just going to accumulate alpha-synuclein and be affected by the same process that is affecting those cells that are dying in people with Parkinson's disease? Are they immune to that, or will they be affected as well? They're looking also at, are they affecting at changing the symptoms of Parkinson's disease, and I think that will be later on once they find a way to answer the first questions. Because if we could get a stem cell that could grow into a dopamine-producing neuron, get it into the part of the brain that is connected to the areas of the brain that control movement, produces dopamine, doesn't overgrow and create a tumor, and then also has those connections and can create a smooth flow of dopamine into those movement centers, then that could potentially be a cure for Parkinson's disease. But we're not quite there yet, because there are a lot of steps that we have to go through before we get to that point. I know some people have talked to me in clinic about a recent rat study that they did. Has anyone heard about that study? Yeah, so there's been a recent study that showed that they're maybe getting to the point where they can produce these dopamine cells And in a rat model, those cells are potentially making those connections that they have to make, and also aren't being affected by that toxic protein like their neighboring cells that are. And so there is some new developments, and no one wants a cure more than people with Parkinson's, including me because my mom has Parkinson's. And so I would love that. And so they're definitely putting a lot of time and energy into it and trying to find a cure.
Is that related to the epigenetic studies?
So which studies are you referencing?
Epigenetics, turning on the ability to turn cells off and on. We talked about developing certain pathways in certain directions, certain cells, and there's a study going on. Epigenetics that was actually taking these cells, and they're using rats to see what they could do in turning the cells off and on, to see if they can get them in one particular direction.
Yeah, so there has to be a lot of background research in a lot of different areas before you can figure out how to make a cell differentiate into a specific type of cell, so it does include research that's done in epigenetics, yeah. So, that's kind of an overview of a lot of the things that are going on. I know that there are probably a lot more specific questions that we'll answer in the panel in just a few minutes, but thanks for your attention.